Welcome to Module 1.5, where we'll explore evidence hierarchies in healthcare research. In this session, we'll examine how different types of research evidence are traditionally ranked, and consider both the benefits and limitations of these ranking systems. This understanding is crucial for evaluating the research you'll encounter in your practice. Evidence hierarchies are systems for ranking research quality and reliability based on methodological approach. They were developed to guide evidence-based decision-making by helping practitioners quickly assess which evidence should carry more weight. It's important to note that these hierarchies vary somewhat by discipline and purpose. What's considered gold standard in clinical medicine might differ from public health or health policy. Generally, these hierarchies consider research design and methodological rigor as primary factors in ranking. They help us evaluate the overall strength of evidence for a particular intervention or approach. Understanding these hierarchies gives us a starting point for assessing research, though, as we'll see, they also have important limitations. The traditional evidence pyramid places different research approaches in a hierarchical structure. At the top, we typically find systematic reviews and meta-analyses, which synthesize findings from multiple studies to provide comprehensive evidence. Just below are randomized controlled trials, valued for their ability to establish causal relationships through controlled experimentation. Moving down, we find cohort and case control studies, which are observational but still allow for comparison between groups. Toward the bottom are case series and case reports, which describe individual cases or small groups without comparison groups. At the base, we find expert opinion, which relies on professional judgment rather than systematic research. This hierarchy reflects a value system that prioritizes controlled experimentation and large sample sizes as markers of reliability. Not shown, but often included in expanded hierarchies, are qualitative studies, which traditionally have been ranked lower despite their different but valuable contributions. While evidence hierarchies are useful tools, they have important limitations. First, context matters tremendously for evidence application. What works in one setting may not transfer to another, regardless of study design. Different research questions fundamentally require different methods. RCTs are excellent for testing interventions, but poor for understanding patient experiences or cultural factors. Quality can vary significantly within design types. A poorly conducted RCT may provide less reliable evidence than a well-designed observational study. Qualitative evidence, though often ranked lower in traditional hierarchies, provides unique and valuable insights, particularly about processes, meanings, and contexts. A more nuanced approach considers the fit between research question and method rather than applying a rigid hierarchy. In your practice, use evidence hierarchies as a starting point, but always consider these additional factors when evaluating research quality and relevance.